This session was filmed March 19th, 2021 during the annual Public Administration Research Conference. The speaker today is Dr. Donald Moynihan, McCourt Chair at the McCourt School of Public Policy at Georgetown University. His keynote address, Administrative Burden, a Framework for Research and Practice, was presented at this year's conference.
Okay, welcome everyone. I hope everyone has been enjoying the panel sessions thus far. Again, my name is Deborah Carroll. I'm director of the Center for Public and Nonprofit Management, which is the organization that hosts this conference each year. I've been listening to some really fantastic presentations, and so I hope that you've all been enjoying them as well. I first need to thank our sponsors for this conference, for which would be made much more difficult without their financial contributions. So thank you to the College of Community Innovation and Education, the School of Public Administration, the Office of Research, the organization CBC Helps, and Advisory Board member Chad Brown, who works with career counseling and consulting. So thank you all for your support of this conference. Now we have the distinct pleasure of having our keynote address being delivered by Dr. Donald Moynihan. Dr. Donald Moynihan is the inaugural McCourt Chair at the McCourt School of Public Policy at Georgetown University. His research examines how to improve how government works. More specifically, he examines the behavioral effects of efforts to improve public sector outcomes through government reform, as well as the administrative burdens people encounter in their interactions with government. Dr. Moynihan has presented his research on public sector performance to policymakers at the US Office of Management and Budget, the World Bank, OECD, as well as many governments all around the world. His research has been cited in President Obama's budget proposal, and he has also written for the New York Times, the Washington Post, The Hill, and other venues. A native of Ireland, Dr. Moynihan completed his Bachelor of Arts degree in Public Administration at the University of Limerick and his Master's and PhD in Public Administration from the Maxwell School of Citizenship and Public Affairs at Syracuse University. And there are a very long list of awards and distinctions that Dr. Moynihan has received over his time in the Academy, and you can certainly read more of his bio in the conference program. Today, he is going to spend some time talking with us about administrative burden and present us with a framework for research and practice. So we will turn this over to Dr. Moynihan, and then at the end of Dr. Moynihan's remarks, Justin will help to facilitate Q&A if needed with Dr. Moynihan. So thank you very much. I turn it over to you.
Thank you so much, Deborah, and to Justin also for helping me get set up with this. I'm delighted to be able to have a chance to talk to you. I wish it was in person, but hope there'll be some point in the future when we can actually correct that. So this topic I'm going to talk about is one that I've been working on in different ways for over a decade now, I would say. And the talk will sort of give an overview of the topic, and then towards the end, think a little bit about what it means for contemporary policy today. And so I want to start by acknowledging my co-author on much of this work, which is Pamela Hurd. And a lot of what I'll talk about derives from a book that was published in early 2019 called Administrative Burden. And I'm actually going to start by talking about the opening paragraph from the book, and I'll just read that for you. And this picture that you see is of Merle Mayo and her family members. After September 11th, amid unimaginable grief, victims' families found themselves awash in paperwork applying to everything from workers' compensation to private charitable support and life insurance. Merle Mayo lost her husband in the World Trade Center. In the days following her death, she spent countless hours finding out what financial resources she was eligible for. filling out forms, pulling together documentation, and dealing with officials who offered varying levels of help and sympathy. Everything was scattered all over the place, she said, and then I thought about all of the things I had to do and all the laundry that was overflowing from the hamper. I felt so overwhelmed that I broke down so badly I couldn't even catch my breath. I sat down on the floor just like, I have to do this, I have to cry now, and I did. Yet Mayo remembered one application process as being refreshingly simple: Social Security. She just had to make a phone call and fill out a simple form online, or if it were more convenient, she could get help at one of more than 1,200 Social Security Administration offices across the country. The first Social Security checks arrived to victims' families on October 3rd, 2001. So we started talking about this example in our book because we wanted a positive example of when government worked well, and one that illustrated that government can work well by shifting aside administrative burdens to provide valued resources and support to members of the public. And it's in that spirit that we lay out what is, in often cases, a critique of government and ways in which it could do things better. So with that in mind, here are the sort of three big topics or questions I'm going to pose today. First, what are administrative burdens? If you've never heard of the concept before, what does it involve? Why burdens matter? And what we might do about them as researchers or as practitioners who work in the public service. We were interested in this topic as researchers because we tended to see lots of different disciplines, from economics, political science, sociology, use different descriptions for a common phenomena that we also saw as relevant to public administration. That is, people's experiences of different types of frictions that made it harder for them to access things that they wanted to access. And so part of our project here was to develop a language and framework that would help to unify these different approaches and also help us to communicate with people working in the field of practice. By using sort of standard language and terms, it becomes, we think, a little bit easier to do that. One important caveat before I go any further is to clarify that we're not making the claim that administrative burdens are always bad. Instead, we are focusing our attention to those situations where administrative burdens probably are not justified by the benefits that they produce, but there are often cases where government has a legitimate role in maintaining burdens to protect other important public values. So what do I mean by administrative burdens? We define the concept in terms of three broad types of costs: learning costs, compliance costs, and psychological costs. And by learning costs, I mean engaging in search processes, collect information about public services, if they're relevant for you, if you're eligible for them, what you might get for them, what it might take for you to apply for a public service, for example. And one basic point we uncovered in writing our book was that people often have sort of a fairly limited understanding of a range of public services that they're eligible for. And so here's an example from the Earned Income Tax Credit, which has about an 80% take-up rate. And by take-up rate, I mean about 80% of the people who are eligible for the program actually get it. And that's on the high end of social programs in the United States. It's one of the best performing in terms of take-up. And yet people who benefit from the program are often unaware of the program's existence, or underestimate the benefits that they might receive, or believe wrongly that they would not qualify for the program. And these learning costs, that this sort of lack of knowledge they have about the program, is remedied partly by the IRS, which sends out reminders to people that they believe to be eligible. And my colleague at Georgetown, Dave Manoli, is an economist who helped to design these sorts of reminders and found that using simple language and specific numbers and short messages significantly improved the take-up rate for EITC. So this is an example of one of the postcards that he helped design. But it's also, those learning costs are also addressed by third parties, specifically the tax preparation industry, which helps to make sure if you're eligible for the EITC, if you go into an H&R block, they'll make sure that you get it. The second category of compliance costs could be understood as following the administrative rules and requirements that are needed to get access to benefits. And so here we're talking about filling out forms, driving to an administrative center, maybe going to an in-person interview, hiring a lawyer if that is necessary, dealing with the discretionary requests of street-level bureaucrats, anything we sort of think of as traditional red tape. One way in which we might think about the size of compliance cost is by looking at instances where they have a dramatic effect on take-up. And so this graphic comes from a study from the Kaiser Family Foundation from a couple of years ago, at the point when the Trump administration was considering adopting work requirements for Medicaid. And by their estimates, using prior experiments with work requirements, something like 4 out of 5 people who would lose their Medicaid benefits because of work requirements would actually not be losing it because they were ineligible, but because they couldn't deal with the paperwork involved. And that's a huge proportion of people who would lose benefits simply because of compliance costs. The third category of costs we identify are psychological costs, and this is perhaps the least studied type of costs when it comes to administrative burdens. Here we're thinking of the stigma that people might experience in accessing an unpopular social program, a sense of loss of autonomy that they experience if they're subject to the control of state actors, or the experience of stress or frustration or anger that results from those experiences. And I've talked a lot about social programs, so I'll give an example from a different area, which is voting. And Rutel Frank here was a litigant in a court case against Wisconsin's voter ID law when it was introduced. She did not have what the state regarded as an appropriate birth certificate because of errors that were made when she was born, but she had lived in the same house for 85 years, had served as an elected official on the village board, and then talked about what it felt like when she was told that she didn't have an appropriate form of identification when she wanted to vote. So she tried to register, and they said, you can't do it with your current identification. And she said, I felt so downtrodden, it just felt like I wasn't as good as anyone else. Part of the reason why it's difficult to capture these psychological effects is that they are somewhat subjective. And so it becomes difficult to quantify them. One way that as researchers, we're trying to figure out a better approach to this is to look at physiological indicators that get at those psychological costs. So this is a screenshot from a lab experiment I'm running with some co-authors in Germany, where they have facial recognition software that codes your facial responses for different types of emotion. And so if you express disgust, frustration, or anger, the software is usually able to distinguish between those features. And we're looking at what happens when you give people administrative tasks of varying complexity. And what we find is, perhaps not surprisingly, people express strong or negative emotions when they're asked to do repetitive or frustrating tasks. So that's what burdens are. Why do they matter? I think I've sort of already started to hint at this, but the sort of big point is that even what we might think of as relatively small burdens can have big effects. And it's not just that they have big effects on things like take-up of programs or access to valued rights like the right to vote. The distribution of those effects may not be equal across society. That is, they might fall harder on some groups rather than others, and thereby reinforce patterns of existing inequality. And finally, these burdens matter because these direct experiences of government shape our views of government. To a degree, I think we have traditionally underestimated when we've thought about both the study and the practice of public administration. So some examples here, burdens can make the necessary and required interactions we have with government just more onerous. So we all have to fill out taxes. Well, most of us do. If you have very low income, you don't have to, but well over 90% of us fill out our taxes if you're an adult age earner. And that constitutes about 7.4 billion hours each year we spend on tax reporting. Much of those 7.4 billion hours, we are providing back to the government information that it already has. And this is by far the biggest source of time and effort in federal paperwork, which is the tax reporting system, when for something like 40 to 50% of people who submit their information, the federal government already has everything that they're providing to them. And so it's sort of a loss of time on their part. For interactions with the state that are not required, where we have the opportunity to opt out, even if it hurts us to do so, administrative burdens makes it more likely that we will do so. And so this is a photo of a Medicaid recipient in Arkansas. Arkansas became the first state to introduce work requirements for Medicaid a few years ago. A paper published in the New England Journal of Medicine tracked a cohort of working age adults and found that so first of all, found fairly large effects, about 7 percentage point reduction in Medicaid coverage for those adults, and also found that for the majority, something like 95% of those adults, they should have been exempted from the policy, either because they had a disability or they were actually working the required 20 hours per week. But again, the problem was they were just unable to deal with a fairly onerous reporting system. So thousands of people lost Medicaid coverage as a result. So this then gets us to the inequality question. We think there are a couple of different ways in which administrative burdens can reinforce patterns of inequality. One is human capital differences. And by human capital, I mean the sort of bundle of skills and personal qualities we all have that make us more or less successful as we engage with our daily life. This includes things like mental health, education, knowledge, personality attributes like persistence. And to some degree, some of those characteristics are innate, but a lot of them are also contextual. And so this paper that we published in PARC last year talks about some of those contextual factors where we have really strong evidence that if you experience serious illness, a shock in life like a job loss or loss of a relative, or age-related cognitive decline, so fairly common contextual experiences that undermines your executive functioning, so the part of your brain that can perform sort of administrative type tasks, precisely at a time when you might need help from the state, that you might need additional support. And so we talk about this as sort of a human capital catch-22. When you're sort of at your lowest because of experiences of stress or scarcity, that really undermines your ability to get help. We also know that more marginalized groups might be more targeted by burdens for a couple of different reasons. One is they're more reliant on means-tested programs, which are inherently more burdensome because the state has legitimate interest in sorting out between groups who are and who are not eligible for a program. And secondly, because of discretionary bias on the part of street-level bureaucrats. And so we have, across a variety of settings, evidence that marginalized groups are more likely to receive some element of bias against them by street-level bureaucrats. Now, the size of the effects of this bias is not always large. There have been a variety of studies, and it's not the size is sometimes fairly small, but you do see these patterns where, for example, if actors with a Black sounding name or a Latino sounding name ask for information about voting opportunities, they're somewhat less likely to get information from election officials. In the study I co-authored with Asmus Olsen and one of his former students, we looked at this in the context of education access in Denmark, where we compared the experience of Muslim families and Danish families in trying to get access to schools, and found that those with Muslim names had a fairly significant degree of greater difficulty in transferring to a school simply as a function of their name. Okay, so if you believe then that these administrative burdens are real, that they have sort of non-trivial effects, you're probably also interested in what we can do about them. And so we've been developing a research agenda on this topic that I think has been gradually growing. And it's really exciting to see other scholars and students take on this challenge, but also to see people who work in the field of practice adopt some of these ideas as well. I think a starting point for any discussion of this topic is a recognition that burdens are something that are constructed. They're not found in nature, they are not inevitable, they are a function of administrative and political choices. In some cases, those choices are justified. In some cases, they're much harder to defend. Some of the claims we make in our book, as we look across a series of policy areas that feature varying levels of administrative burdens, is that the politics of burdens are such that political actors, if they are opposed to the distribution of a program, will then be more supportive of imposing burdens into the implementation process. And this point sort of echoes an argument Terry Moe made in the 1980s about the design of bureaucracies, which tends to be the result of complicated trade-offs and compromises between groups who have very different goals. But his argument was that the losers in these debates, the people who did not want to see a bureaucracy created in the first place or a program created in the first place, will find ways to undermine the implementation of the program. And what we're adding to that, I think, is that the application of burdens is a tool for them to do so. It's also quite an attractive tool because administrative burdens are opaque. This is not like having a debate about, say, who is eligible for a public sector program and changing the law to rule some people out or some people in. These tend to be very visible, high-level debates. Debates about things like how many questions we should have on a documentation request, whether we should have asset tests, whether people should come to an office in person, or whether we should allow them to do phone interviews instead, whether application processes should be online only, or whether you can apply multiple ways. We sort of intuitively think of these things as the details of administration rather than policy. Therefore, we don't cover them to quite the same degree in the media. We don't cover them in political venues like the legislature. We tend to defer them to the executive branch, and thus they become unattended to and a powerful tool for actors, especially in the executive branch, to use to make programs more or less complicated. What can we do then as researchers and as practitioners? I think a basic sort of speak truth to power principle suggests that where possible, we provide evidence of the existence of burdens and the consequences that they generate. And so this means thinking about maybe a different set of dependent variables than we've traditionally thought about in the field of public administration. So for example, looking at take-up rates, what proportion of the eligible population actually accesses a program? thinking about things like civic effects of administrative burdens. So if people have experiences with the public organization that they find to be more or less burdensome, how does that then influence their political beliefs? And I would recommend the work of Jamila Michener, who wrote a wonderful book on Medicaid that sort of tracked this logic of how a policy feedback experience occurred when people had negative experiences on the program, that really shaped their views of government. You could also extend that point to the study of policing, work by people like Veshla Weaver and Joe Sauce, where they talk about how in some communities, police and negative experiences of police are the primary experience of government, and then that just colors people's broader interpretation of government. The second type of category is the tolerance of burdens. And here I'm thinking about this as potentially a dependent variable or independent variable, but understanding why some people are simply more comfortable with administrative burdens. Why this could be members of the mass public, so the just general citizens, policymakers, or street level bureaucrats. You can see there's a picture of a paper there by Martin Baker and Meta Thompson and I, where we looked at this question of policymakers, and we ran an experiment that found that if you framed the clients of programs to be more or less deserving, people tended to be more or less tolerant of burdens. So clients who were perceived as being undeserving, policymakers felt more comfortable imposing administrative burdens upon them. We also found, and I think this is true in other areas, that more conservative policymakers were more supportive of administrative burdens in distributive policies. So this doesn't mean that conservatives are always supportive of administrative burdens, but in the policy domains that they might be more suspicious of, they're more supportive of burdens within those policy domains. A third category of variables could be the creation of burdens. So how are burdens established? And I think this is sort of an important point because bureaucracies have a tendency towards the status quo, and they'll often take for granted that burdens exist and should be maintained because they've always existed, rather than critically ask, well, how did this come to be? And is this purpose still being served that might have justified the creation of burdens 10 or 20 years ago? I think researchers can also not just help provide answers to some of these questions, but also increase the topic salience of this question. And so I think a way that it was probably not the case 10 or 15 years ago, when people talk about administrative burdens now, they have maybe a deeper understanding of the fact that this poses a barrier between the citizen and the state that can cause frictions. I'm posting a screenshot of an article in the New York Times where they ran a quiz about the administrative burdens that people experienced and whether people could sort of overcome those burdens. For governments, I think there are some general principles, and so rather than talk about specific solutions, I think it's more helpful to talk about overarching principles. One is that when governments are thinking about policy changes that might generate burdens, so let's say, for example, they want to reduce fraud in a program, which is a perfectly legitimate goal. They think about the costs of any specific policy changes that would be involved in that goal. Right? So let's say you wanted to introduce asset tests in a program. You should estimate how much fraud we think this is going to detect versus how many eligible participants this will end up kicking off the program. And if you're comfortable with that ratio, you go forward, but at least understand what the ratio is going to be. A second type of solution is to build in routine processes that would measure, identify, and reduce burdens in government. And so would look at existing rules and procedures and think about where burdens exist in those. Cass Sunstein has called these sludge audits, and this sort of makes intuitive sense to us. We also would extend that to beyond government. And so when a government contracts for services, will contract with private contractors, we typically contract for two things. One is finance, like how much you're getting paid, and the other is hopefully performance, what you're going to do in return. We think governments should also be contracting for the experience of administrative burdens to make sure that contractors are not achieving those other financial goals or performance goals at the expense of citizens' experience of the state. There's a broader toolbox here that policymakers can use. Some of these are nudges, like informational nudges, things like reminders that help people to reduce learning costs. And there's some contexts in which those work pretty well. Some are process simplifications, like the sludge audits that I talked about above. A third category of solution is help, just providing help to actors who are struggling with administrative processes. This help could come from government itself, or it could, as with the example of the tax reporting case, come from private sector, third parties, or nonprofits. Another type of solution is auto enrollment, or changing the default for public sector programs. So if the government has administrative data that identifies someone as eligible, you would enroll them in a program with the option to opt out, as opposed to requiring them to enroll themselves. And so this would add some degree of simplification for them by essentially removing all of the administrative burdens they would normally face. In the last couple of months, we've seen a lot of these debates pan out in practice in the discussion of the pandemic. So if you look at the COVID relief experience, we've seen a couple of different types of solutions. So I'm including a picture of your governor here, where for the unemployment insurance system, I think there's general agreement that would vary in degrees, but generally the system worked really poorly for a large influx of people claiming unemployment. And in part, this was because of information technology problems. In part, it's because of the surge of new applicants, but also in part because, as Governor DeSantis points out, in the context of Florida, there were lots of states where the unemployment system included pointless roadblocks that seemed designed to deter people from actually applying for their benefits. So that's sort of maybe the low end when we're talking about the experience of administrative burdens. The pandemic relief bills also provided some positive examples. If you think about the checks or direct deposits that people were sent out, this is an example of auto enrollment, where the federal government has taken administrative data, generally your tax returns, identified if you're eligible or not, and sent you a check based on that in the vast majority of cases. And so you've had to do nothing to apply for the benefit in almost all cases. The current debate that policymakers are having now with the American Rescue Plan that was just passed is the goal of creating something like a children's allowance out of the child tax credit, which the bill that was passed places as a responsibility on the IRS, whereas people like myself and others have argued it probably would be better situated at Social Security Administration, simply because they have field offices, they have a reputation that's positive, and they have a capacity to manage customer service in a way that I think, frankly, the IRS doesn't generally have. Looking at the shift from the Trump administration to the Biden administration, you see very specific actions by the Biden administration to withdraw specific burdens that the Trump administration had imposed. So the work requirements in Medicaid that I discussed, or the public charge rule for immigrant applicants, which would have required them to document that they weren't subject to poverty or risk losing public benefits. And you also see sort of a proactive approach on the part of the Biden administration, in particular, identified within the executive order on racial equity, where there's a section of that, which is presented here, specifies that agencies have to look for services where there are barriers to access, and provide a plan to minimize those burdens. And so the Office of Management and Budget and the Domestic Policy Council are pushing agencies to do this. They've sent out a service equity assessment that I'm featuring there, which includes a checklist for recognizing and reducing burdens in agency programs. Ultimately, a lot of this sort of discussion gets to the question of whether government can provide big, important services in a way that makes people happy with the experience of government. And our sort of normative stance here is that if at all possible, the experience of government should be simple, accessible, and respectful. And there certainly was a time in American life where we invested quite a bit into those values. And we conclude our book by talking about the Social Security Administration as our sort of exemplar of a well-managed organization that reduces administrative burdens. At the time of its creation, there was something like 26 million people needed to be enrolled in Social Security in the 1930s. It was seen as an incredibly forbidding challenge. One design choice that they were asked to make was maybe to think about giving people stamp books, where they would every quarter get stamps from their employer that represented how much they'd earned, and then they would track those over the course of their life. And eventually, when they were 65, they would return those stamps to the federal government and get a Social Security as a result. And Social Security rejected that approach and created the Social Security number. And in doing that, they shifted burdens away from the individual and onto the state, because the state now had a means to identify and track your earnings across your life course, regardless of where you moved. They also had public relations that talked about the service. They had a culture that was centered on being welcoming to individuals. People were trained to think about clients as someone who were claiming their rights rather than as welfare claimants. And ultimately, the combination of these things allowed what is a really complicated program to feel simple enough and positive enough that it has withstood fairly, at varying points in time, aggressive efforts to reform and change it. And so we think this is a model of how government can work well when it comes to administrative burdens, and partly why we think it would be a better actor than, say, the IRS in providing a child's tax credit. So I am going to stop there. I'm really looking forward to your questions and the discussion and the sort of thoughts you have about administrative burdens or examples that you want to bring to the table. Okay, so I will ask people to sort of raise their virtual hand, and that's the easiest way for me to see them, and I'll just call on people in turn. Jared?
Hello, Dr. Moynihan. Great talk. I was an Army officer for quite a while, and so concepts like administrative burden and red tape are near and dear to my heart. Can't say I miss them, though. So, 2 questions. Have you come across any data indicating how much paperwork people fill out on average, how much of it is repetitive, or how much time it takes to fill out one form on average? And if so, where did you come across that? Because I've searched for it and I cannot find it anywhere.
Yeah, so that is a great question, Jared. So the Paperwork Reduction Act mandates that federal agencies have to, anytime they create a new form, estimate how much time it takes people to fill out those forms. I will tell you, I'm generally very skeptical of those estimates and how they're created. I think they sort of get a focus group together. I don't think they really think about the distribution. So they have these average estimates, and you know, the average for one person might be completely meaningless for another if someone else has, say, to pull together lots of information about a disability or medical forms. The 25 minutes that's estimated on the form it does not reflect that. And I also think the forms do not take into account what we're thinking about as learning costs. They sort of assume that you start with all of the information that you need in front of you, and then you just go through the form.
Yeah.
So that is the closest thing that we have to something that tries to systematically track information. And I think the Paperwork Reduction Act is a good idea, which has never been really properly implemented in practice. And I hope it'll be picked up and used more aggressively as a tool by the Biden administration.
I've studied that a bit, the Paperwork Reduction Act, and they still put out reports of how much paperwork they reduce every year. And yet it always seems like it's never made its way down to me.
Yeah, I think it's one of those situations where it's become this sort of mechanical information collection reporting process rather than an actual tool for managing processes in government. And the only time I hear of people actually say, the Paperwork Reduction Act changed something I was doing are researchers in government who are trying to survey members of the public, and they're told, oh, you have to reduce some questions because the survey is too long. So who else has questions or comments? Yes, Justin.
Yeah, let me just say I'm glad you highlighted Florida, because as you talked about the challenges of executive running of programs where they might inject or design difficult processes to slow roll the execution of a program in the community is a real thing. I noticed it when I was in Texas as well. In the early 2000s, they had a welfare program there that required folks, and it was oftentimes the folks who were the least able to take time off work to go downtown to fill out paperwork for unemployment benefits. And it was kind of a disgrace, because those are the folks that, if they did have a job, they couldn't afford to take time off in the middle of the day to take a bus downtown to fill out the paperwork once a month. And so I'm glad you highlighted that, because that's we talk about public administration and being aware of the problems we're trying to overcome. Sometimes paperwork minimization or just being an extra hand is important to help people.
Yeah. And I one thing I didn't mention in the talk, but I think is worth highlighting, is that if you're an academic in this area and you work in the field of economics, since the 1980s, the way in which they've thought about this is ordeal mechanisms are a good way of rationing public services. And so the logic is you make things a little bit difficult, and then the people who are really desirous of those services, who really need them, they'll be the ones who wait in line, they'll be the ones who get through the forms. And so that's a theory, right, of why people will get past administrative burdens. That sort of fits nicely with the idea that there's an optimal level of burdens that allows you to efficiently target resources to those mostly in need. And we think that theory is mostly wrong because of human capital variation, where in fact it might be the person who really is in need who cannot spend the time in line, or just does not have the capacity to manage a bunch of forms. And so there's a little bit of a friction between the way in which we're thinking about things and the way in which economists have traditionally thought about this issue. Deborah.
Thank you for another really great talk. I just wanted to maybe kind of trail off on what you just said. So you mentioned in the beginning of your talk as well that, a high administrative burden kind of perpetuates inequality because it affects, access to services that are important and needed. And, we saw, I think, a lot over the summer and even into the fall, a lot of response to the Black Lives Matter movement that I feel has been largely symbolic, to be perfectly honest. So we've seen, streets renamed, we've statues removed, that sort of thing. But, to really bring about substantive change, it seems to me that some administrative burdens are going to have to be reduced. And so I just wonder where you would suggest kind of targeting our efforts to move past these symbolic changes, into something that's going to be more substantive and long-term going forward.
And are you thinking about policing in particular?
I mean, that's certainly one aspect of it, but not exclusively.
Yeah, I mean, this topic was one we were talking about in our in the class I teach this week as one of these sort of inherently difficult topics to address, and it's partly because you have the public has really different beliefs about what's going on and about what the potential solutions are, and you also have state actors, and in particular, I'm thinking of the police here, who are sort of broadly popular and have a lot of political power, and so have used that historically to protect members from what they see as unnecessary oversight, right? And so I think some of what has to change is that things like, and now I'm getting a little off topic, but things like collective bargaining exclude issues related to things like discipline, right? That in some ways, you might want to have more administrative burden for state actors in this particular case, where you have things like civilian boards having more of an oversight when it comes to judging actions about whether rules were broken or not. You might want to have more transparency on things like disciplinary records. Right? And so, this might be an example of where more administrative burdens would be helpful. That doesn't necessarily mean they're costless. They might still affect how people do their job in a negative way in some domains, but that on net, that they would be beneficial. And sometimes people will ask, can you think of examples of administrative burdens that really are helpful? And I think this is, again, slightly off topic, but if you look at the opioid epidemic and its spread across the country, you see a markedly lower spread in states where doctors had to fill out more forms before prescribing opioids. That's simply requiring them to justify what they were doing, adding a little bit more paperwork, slow down the distribution of both the drugs, but then ultimately opioid-related deaths in those states. And I'm not sure at the time people were thinking about that in quite this structural way, but that was ultimately the sort of cause and effect in those cases. I see Jared.
Hello, I'm back. In his book, Rules and Red Tape, Barry Bozeman notes that there is not a real theory of red tape or a concrete definition. My question for you is, how do you distinguish between administrative burden and red tape?
That's a great question. And I don't know if Barry was here, if he would agree with me or not. So I'm glad he's not. I would say part of the genesis of this project came from some of what I perceive to be limitations of working within the red tape framework. And so when I was a graduate student, I wrote one of my essays on red tape. I've written a bunch of papers about red tape. And then I hosted a mini conference about red tape when I was in Wisconsin in about 2011. And it was sort of after that point, I really thought, well, I need a different framework to get at the types of questions I'm interested in, because I don't think I can get there from here using the red tape approach. And maybe I was wrong about that, but that was my interpretation. And it was for a couple of reasons. One is just historically, if you look at the field of red tape, the empirical focus has been on the perspective of managers, right? How people who work in public organizations experience rules. But secondly, I think that's partly tied to definitional aspects. And so I have a new paper that's just coming out in public administration where we talk about red tape, ordeals, sludge, which is how Cass Sunstein defines this idea, and administrative burden, and just tracks all of the definitions and tries to make sense of how they overlap or don't overlap. And honestly, there's a lot of overlap. But red tape is definitionally generally been about rules, like that's at the heart. So the sort of classic Bozeman definition is that red tape is rules that exerts compliance costs and zero benefits, which is a really strict definition because most rules have some benefits, and sometimes the benefits justify the cost, sometimes they don't. But the idea of having a rule that has absolutely no benefit, it's really tricky to find that in practice. And in practice, then, it's very hard to study rules without studying people's experiences of rules. And so our approach definitionally is to start with the experience of the state, which includes not just rules, but also, it could be informal encounters with street level officials. All right. So if a cop pulls me over, I might not experience any red tape in that encounter, but I still might experience some sort of psychological cost. And so I want to study that, but I can't study that from a red tape perspective, but I can study it from an administrative burden perspective. And so it's a little bit broader because it starts from the citizen's experience of the state. And I'm using this term citizen sort of very broadly here, but it starts with their experience of the state as the starting point to think about how, in general, the citizen and the state meet each other.
We have about 5 minutes left. If anyone else has a question, now is your chance.
May I, Deborah?
Please.
Thank you. Thank you, Don. Good to see you. Good talks yesterday and today. And if you can share your observation briefly, I know we don't have too much time. You've been doing research on performance measurement, performance management, and many of the research on the topic heavily relied on perception data. And what is your observation, potential contribution of doing research in administrative burden on performance research as well?
Well, that's I've never been asked that question before, so now I don't have a ready reply to that.
On what I asked?
Yeah, on the connection between the two things. So I think one thing that is different and harder about studying administrative burdens is that we want to anchor it in people's experiences. And so that makes it harder to do things that I normally do to study performance management, like survey experiments. Like I can run a survey experiment where I give you performance data, and then in the control group, I changed performance data, and I can see how you respond to that data. And that maps on reasonably well, to real life. within some constraints. With the topic of administrative burdens, I can ask you, how do you think you would respond if the form was 60 pages long versus 20 pages long? And you could give me an answer, but I'm much more suspicious that that answer isn't valid because it isn't connected to your actual experience. And so in thinking about designing experiments, which, we're social scientists, we love experiments, it makes the job a lot harder because you don't want to design these really superficial experiments that don't actually reflect people's experience. And at the same time, there's some ethical constraints in how you design experiments. You don't want to make them incredibly painful for people. And so I've been working with Martin Baker, with his group of researchers, and Fabian Hatke in Hamburg with their researchers, and we think about this all the time. So what Fabian's solution is to use his physiological indicators, so things like the facial recognition, ask people to perform a real administrative task. It's not terrible. They just have to fill out a few forms. It's not incredibly stressful. With Martin, we've sort of struggled to find good solutions. And so what we've done a lot of instead is to look at two different things rather than people's direct experience of burdens via experiments, is to use the really great administrative data that they have in Denmark. So we have one paper where we look at people's the consumption of antidepressive drugs. So we're taking that as our measure of psychological costs in the aftermath of negative messaging towards the unemployed. So our causal story is you see a lot of negative messaging towards the unemployed in time one. That's new and different, and it affects people's consumption of antidepressants in time two. And we have such incredibly detailed data from Denmark, we can sort of pull that off. So that's been sort of one of our solutions. The other solution is to pay more attention to burden tolerance as variable, because that you can sort of get at in a more realistic way. And that's closer, I think, to performance information use. So I can give you information about two programs and ask you which do you think is more acceptable as an administrative design, as a policymaker, or as a member of the public. And that will, I think, be a fairly valid representation of your opinion, but I'm not asking you about your experience of the burden itself. And one sort of fascinating finding from the paper I mentioned with Martin Baker is that we found that policymakers who themselves had been on welfare, so at some point in their lives had been on welfare, were more opposed to administrative burdens in welfare programs, right? So something about personal experience matters to your perceptions then.
Great. Well, thank you so much. We've now reached the end of our time for this session. So everyone, please help me in thanking Dr. Moynihan for a really fantastic presentation again today. And it's just such a pleasure to have you come and be a part of this event for us. So thank you.